It's 2030 and South Africans can walk into any clinic or hospital without a care about bills or quality of service. Universal healthcare has become a reality and everyone has access to world-class primary healthcare. Well, at least that's the vision under the National Health Insurance, to fundamentally change how healthcare is structured and close the inequality gap. South Africa spends roughly 8.5% of GDP on healthcare services. About half of this is spent in the private healthcare sector, which services 16% of the population. Now, these are the people with medical aid or who can pay cash for services. The other half of this expenditure is in the public sector that services 84% of the population. That's about 47 million people. The aim of the NHI is to level the playing field by creating a single medical aid scheme for everyone. But how will the NHI impact our lives and our pockets? Well, this is what we know so far. The NHI will be compulsory for everyone. We'll all contribute to the NHI fund, mainly through the national fiscus and payroll taxes. What you pay will be directly proportional to how much you earn. If you choose to stay on your private medical aid, it will not exempt you from contributing to the NHI. Instead, you'll have to pay for both. Government also hopes to curb exorbitant fees in private healthcare through the NHI. Now, prices in the sector rise above inflation every year, and this leads to higher medical aid premiums. Some of the contributing factors to these increases include, but of course are not limited to, the rising in-hospital costs, the spiraling cost of specialist healthcare, and healthcare fraud. The Board of Healthcare Funders Forensic Unit has found that 7% of all medical aid claims in South Africa are fraudulent. On paper, the NHI is consistent with the global vision that healthcare should be a social investment. But we still have some major hurdles to overcome. Firstly, how will public clinics and hospitals be re-engineered to provide quality healthcare for everyone in the country? Some of the facilities are shambolic, to say the least. Can they be turned around by 2030? Secondly, is the funding model for the NHI sustainable? The fund will require at least double the current annual healthcare budget. That's about 4 soccer World Cup tournaments. And thirdly, there's still lots of questions about the future of medical aid schemes under the NHI. What role will they play? What kind of services will they be able to provide? And how much of the resources they use will be opened up to the greater population? Government is committed to the NHI. What it now needs to do is show that it can turn that commitment into action. Make your health matter. I'm Kathy Motlahlana.